Hi, I'm Pat Graham. Welcome to Parent Helpline. Today we're going to be talking with Cindy Trainer on a very important subject about prenatal care. And Cindy, you are a clinical nurse specialist at the Birth Center at the Carol Jovecki Women and Children's Center at St. John's Hospital. And you are one of the leading advocates of preconception care. And this is something that most of us don't know too much about. The fact that care before you even think about getting pregnant is the most important care to prevent birth defects and prematurity. And I know when I had my babies, we didn't think about this. Most of us knew that it was important to take care of ourselves when we're pregnant, but the pre-pregnancy was not a concern. What is this preconception care?
Actually, the most important part of planning your family is that visit that you make to the doctor or to a healthcare professional, certified nurse, midwife, whoever you seek your prenatal care from. The most important visit that you can make is the visit that you make before you even become pregnant. In the year, hopefully a year before you become pregnant, you would visit the physician or healthcare provider, get a complete physical examination, and talk to them about concerns you may have with your health or the health of other members of your family, which could possibly affect any other children that can be born. Looking at lifestyle factors, risk factors in your life are very, very important. Looking at things like your nutrition, looking at smoking and drinking seem unimportant when a woman is not pregnant, but since about 50% of all pregnancies really occur as so-called oops or unintended pregnancies, it's very, very important that women are always vigilant. If they are in a relationship where they could possibly conceive a child, that they are maintaining good lifestyle habits in order to protect a baby.
50% of pregnancies aren't planned. It doesn't mean they weren't wanted or whatever, but they aren't planned.
Exactly.
Not at this time,
right.
Or not even necessarily in a relationship. These happen.
Exactly.
We have a lot of teen births, and these 50%, you could say, well, I'm going to start being good. I'm going to start taking care of myself, eating right, whatever. Go to the doctor when I'm ready to get pregnant. But half of us would miss that opportunity.
Exactly.
So, what age? When do you start thinking about this?
Any woman
as soon as you could have a child, anyone who could have a child?
Anyone of childbearing age should think about how their health could affect a baby years down the road. They may not be really even planning a pregnancy or even in a situation where they could conceive a pregnancy, but they always need to be thinking about how their health could affect a baby even in subsequent years. Things like maintaining a healthy weight. Obesity is a terrible problem in our country, and obesity really does affect a woman when she is carrying a child. So issues
and underweight.
And underweight also. Exactly. Poor nutrition affects a baby at both ends of the spectrum, either underweight and overweight. Not becoming addicted to any kind of medications, whether that be prescription medications or illicit drugs, not drinking, not smoking, and really healthy lifestyle habits, getting plenty of exercise, making sure that your health is the best possible health, not only your health, but the health of the person who may father the child is also very, very important too.
Because it takes two. And
exactly.
So the genetic makeup and any problems that you have in your body can possibly be passed on to a baby.
Exactly. And we're also talking about other factors other than just physical factors also. We're talking about lifestyle and mental health as well as physical health because we know that all of those kinds of things have a big impact on pregnancy and on raising children.
Well, stress. I mean, when you're having mental problems, or you possibly would be in a domestic violence situation.
Exactly.
That affects the mom, and it immediately affects the baby.
Right.
And so, and we know enough now, by let's say about domestic violence, that if someone is abusing, if a male is abusing a female, a woman, either physically or emotionally, that during pregnancy, this increases. It doesn't stop.
It
gets
often
worse.
escalates.
It escalates. So
Right.
that, or if your partner drinks or uses drugs, more violent behavior can be a result that could harm the baby. Besides
Exactly.
the chemical things,
Right.
just the behavior is a huge risk factor that we don't even think about.
And the stress level in the mother definitely impacts the health of the baby. We know that that can lead to preterm labor, and that is a huge problem in our country. Preterm labor causes many low birth weight and preterm babies that can have lifelong disabilities.
So really, when a teen goes on a date,
Right.
or starts seriously dating somebody, these concerns are things, this preconception is a very important part of even deciding who you're going to run with,
Right.
starting in your teen years.
Teenagers are often notorious about avoiding subjects that have anything to do with sex, but we, of course, would hope that all teenagers abstain from sex until they are really ready to be in a relationship, hopefully when they are not teenagers, when they are older. But it's still very important that young people think about down the road, 10, 15 years, past their teenage years, how is their health going to be when they are ready to really have children and settle down. It begins way, way before
marriage
and people actually think about having a family.
One of the things that I've heard a lot about, and I want you to discuss, is folic acid. And that's taking a multivitamin with folic acid is something that, every teen girl, every woman should be doing.
Right.
Why?